Okay, so today I'm going to be talking about my new ambassadorship with Alike.Health, and this is kind of what the app looks like. This is my homepage, and I can scroll through different disorders, and then I can click on Explore Treatments. And I can see what most people on the app are using and what percentage of them are using what I am. So 14% are also using alprazolam, also known as Xanax, and 3% are also using paroxetine, otherwise known as Paxil. So you can see that the data collected, which is HIPAA protected, from your medical records, and I'll show you, because you go here and here's like where your chronic conditions, regular medications, procedures, and lab tests are, and you can see that I have put in my labs, and these are the most recent ones. Yeah, that's a great one, isn't it? Also, this is how you get all that information. You sync, if your healthcare network has the ability to, your information into the website. However, it is 100% anonymous. If you see here, let me go back. This is what my profile looks like. That's not my real name. It just says my, gender and, age. And then I could share a story about myself, and then it lists like the conditions. Yes, I know it's a lot. And my medications, procedures, where I've gotten started, and certain where I was diagnosed with certain things, when I started taking different medication. But no one within the app system can access this information, and connect it to you. So 100% anonymous. And if I go here and I go to Alike, here's the community. So if I go to the anxiety community, which, see, it shows, I can see people like me who are talking about it, just like my other conditions, which makes this such an innovative patient app, that it can take that data and tell you what might help the most. They don't proclaim to be doctors. They do have physicians on here that can answer questions, but this can lead to way better experiences and treatments with more data. Because if the majority does well with medications, like for anxiety, say, right now we don't have a lot of data for anything because it's new. Right now, these two, which I believe this is Ativan and this is The lorazepam, I believe, is Ativan. Let me see if I can click on it. I can. Yep, it's Ativan. And you can even look into what it is, what it does, and then this is Lexapro. So it tells you what it does, how it works, how to use it. And this is based on actual sources that have been reviewed by certified physicians. So it's not a whole bunch of BS. And that's what I really like about it, because let me get to my profile, my medical profile, my lab tests. Here is where it got really interesting for me, is because I was able to see, where is it? Don't look at my cholesterol, it's bad, it's not my fault. Let me find it. Here we go. The viral hepatitis panel. Now, I'm seeing an immunologist right now because I have no, I don't make antibodies properly. But for some vaccines I do, for some I don't. This was proof to my immunologist because I could actually see whether or not the presence of the hepatitis B antibody was present in my blood, which it was not. Nor was the presence of the hepatitis C antibody. I couldn't see or understand this before. And I was able to send this to my immunologist, and he was able to go, okay, we don't have to give you the hepatitis B vaccine that came out in 2018 because you already had it. So that cut off some time that I would have had to take doing more vaccine tests. I have been vaccinated for COVID, and I will be doing a vaccine test for that, and I am getting the Pneumovax 23 because of the fact that I have no antibodies for the pneumococcal 23 subtype tests. And then we're going to see if I develop any from there and go from there. This has helped my healthcare journey more than most things, just due to the fact that I can see more and I can show my doctors more, and I have more information at my disposal to understand what's going on. And I am a medical person. I've been studying medicine since I was very young, and psychology since I was very young, because it's two big interests of mine. And I'm also an advocate for patients in mental health or physical health. So this really is going to be a game changer. I highly recommend you download it. I don't get any money from telling you to download it or getting the word out. I don't. I do get paid for helping and consulting. So just as that, general information is there. I want to be completely transparent. But I really, truly believe in this app. I do, and I want as many people to sign up for it as possible so that we can get as much data as possible and truly help patients in need, and help them understand their conditions and connect with people who will understand them and be able to communicate effectively with their doctors and get them to listen, because that's a really hard thing. If you have a chronic illness, you would know. So I just wanted to show you a little bit about it. Go download it, try it out, no charge. It's not gonna, take your private information and sell it or anything like that. Is 100% HIPAA compliant. I made sure before I downloaded. And I've talked to the CEO, the developers, all of that. So try it out. If it helps you, awesome. I am so happy. If it's not for you, it's not for you. But I really just think this is for everybody. But that's about all I have to say. So give Alike.Health a try on the App Store. It's on Apple and Google. So really, what do you got to lose?